When you visit a dentist and a cavity is noticed or diagnosed, your dentist therefore may have recommended that you have a filling placed. The filling that will be discussed is whether you want a white filling or you want a silver filling. This is a question that we get asked a lot about, and there's lots of incorrect information if you start looking on the internet. So in this article we have hopefully condensed everything down so that you can make a logical and sound decision, not based on emotion. So let's start at the basics. Dental cavities, they're common, aren't they? The answer is yes, they're very, very common. So for example, more than 50% of adults over the age of 20 will have had cavities in their permanent teeth, and these will have been filled at some point by the dentist. But in addition, about a quarter of people have cavities in their mouth which aren't even treated, or they're not being diagnosed. Often a cavity can arise in between a dental appointment or when you're an irregular attender, and therefore the cavity is allowed to stay there. Dental cavities often occur in regions of the teeth where it's difficult for you as a patient to see that you've got a cavity. To start off with, a cavity very early on is pretty much invisible unless you had a microscope looking down onto your tooth. But even when the cavity gets larger, it can be difficult to see these areas because most cavities occur right at the back of the mouth. They also occur in the anatomical portion of a tooth called the fissures. These are little natural cracks in your teeth where bacteria can dislodge and therefore cavities can start. In addition, a cavity can start under the gum line where you cannot see it at all, and finally a cavity can occur in a tooth that's already been filled. So a cavity can occur underneath an existing filling, hence making it impossible to see. Dentists obviously spend a lot of their training trying to recognize and detect cavities. To start off with the basics, you need a good light. That's why dentists work under a good operating light, which is bright and powerful. In addition, they can use a probe which they can scratch the surface of a tooth to see if there are any changes in texture. Obviously, if there's a great big cavity, then there's no need to probe those because those are obvious. In addition, dentists use X-rays, which are extremely valuable and essential to detect cavities. The X-rays can show where the cavity is, how extensive it is, whether it has been involving the nerve of the tooth, and also by comparing X-rays you can see if a cavity has progressed or not. It is very important to mention that the diagnosis of cavities is not an exact science. So you could have 10 different dentists and they all have, or they all may have, a difference of opinion as to how big or how extensive a cavity is, and also how the cavity should be treated. Very, very early decay in a tooth can re-heal itself. It can repair itself. However, once you get past a certain point, then the cavity cannot repair or heal up by itself, and this is where you need intervention treatment. So, as we mentioned before, the most common method to treat cavities is with a filling. A filling is placed once the infected, decayed area of the tooth has been removed, and the hole that is created then has to be filled in with an appropriate material. The material that you use to fill obviously has to be hard wearing, but this is not so easy to achieve because tooth enamel, human tooth enamel, is the hardest substance in the body. So obviously to beat something that is natural is going to be difficult. So the two most common materials for fillings can be classified as silver fillings and white fillings. So often your dentist will give you a choice or will want you to make a decision about which filling you would like, a silver one or a white filling. In order to make a decision on this, you do partly have to reason for yourself, but in order to make an informed decision, you will need some input from your dentist. So let's look at the bare basics of what a silver filling is and what a white filling is. Let's start off with silver colored fillings. Silver fillings are also known as black fillings and more technically known as dental amalgam fillings. Dental amalgam is essentially an alloy, which it means that it is a mixture of different metals combined with each other. 50% of the metal in a filling is made up of mercury. Mercury is the only metal that is a liquid at room temperature. You may notice from your chemistry days that mercury, when placed on a bench or on a surface, forms little drops or globules of shiny metal which run if the table is tilted in any way. So that is mercury. So a filling usually consists of 50% mercury. The other 50% usually combines these three additional metals. The additional metals are silver, tin and copper. Dental amalgams can also have small amounts of other metals, but the most of the other 50% consists of silver, tin and copper. Silver is usually about 25%, so in other words, half of what's left after the mercury has been added, usually half of it will be silver, and then another half of that, about 12-13%, will be tin, and another half of that, about 7-8%, will be copper. The alloy called dental amalgam has certain properties. As a patient, the property that you will automatically associate it with will be that it's silver or black in color. However, the useful properties are that it is known to last a long time in your mouth. Dental amalgams have been around for more than 200 years, and we know that silver or amalgam fillings can last many years. In fact, we often see patients where they had a filling done in their teens and now they are at retirement age and those fillings still seem to be going. So as well as being long lasting, they are hard wearing. As enamel or tooth enamel, which is the hardest substance in the body, in order to replace this when you get a cavity, you do need to have something that's going to be tough and hard wearing. Otherwise, the huge forces that your teeth are subjected to every time you eat will not make a weak material last very long. So we also know that dental amalgams are very hard wearing and they can be in the mouth for many years without showing a lot of wear and tear. So the two advantages of amalgam fillings are that they do last long and they're hard wearing. There are two other big advantages as well which patients don't generally know about, but they are important for dentists. The third advantage is that dental amalgams have a self-sealing property. So this means that when the filling is placed in your mouth, you try to adapt the filling to the walls of the cavity as much as possible in order to reduce any potential gap between the filling and the wall of the tooth. This potential gap is important because a gap means bacteria can go in there and new decay can start again. In addition, the gap can cause sensitivity when you're eating or when you're having hot, cold or sweet foods. So dental amalgam does have a self-sealing property, and this is because the metal produces initial small amounts of corrosion materials, and these corrosion materials tend to fill this gap. So this is a very useful property of amalgam. The fourth main advantage of amalgam is that it is known to be very not technique sensitive. So dental amalgams are not very technique sensitive. They are a very forgiving material. So for example, if you have a filling under the gum line, it is very difficult not to produce so it is very difficult to produce a cavity which is going to be moisture and free of blood, so the filling, because you don't want the filling to get contaminated when you're placing it. However, dental amalgam is quite a forgiving material if a small amount of contamination does occur. So it's extremely good at the back of the mouth where there may be lots of moisture and saliva, under the gum line, deep cavities, and so on. So to sum up silver fillings, they're very durable and they are a good choice for teeth at the back that need to withstand a lot of force, such as on the molars and premolar teeth. Other factors are that the dental amalgam, once mixed, is easy for a dentist to use because it's quite soft and pliable, so you can easily adapt it to the cavity. Silver fillings are also a lot less expensive than alternatives of white fillings, so they are quite good for your bottom line. So let's look at the main drawbacks of silver fillings, and they can be divided into two broad categories. Number one, they're not very aesthetically pleasing, and number two, let's look at the health concerns. So let's have a look at the aesthetic problems. Dental amalgam, as we said, is an alloy of metal, and it is formed by mixing together mercury with three other metals of silver, tin and copper. The end result is that once the amalgam has been placed into the cavity, it will harden over the next 24 to 48 hours. One good advantage of amalgam is that the initial hardening phase is relatively quick, so a large proportion of the filling will have hardened before you leave the dentist. But you still have to be careful in not eating anything too hard for the next 24 hours in case you accidentally break or fracture the filling. So they are not very aesthetic, but quite often the amalgam placed in the cavity is at the back of the mouth where you can't see much anyway, so often it doesn't make as much a difference as most people think. The other main concern that has been cited with amalgam fillings is that of the mercury. As discussed above, silver fillings contain a mixture or an alloy of mercury, silver, tin and copper, and it is the mercury element that people are or can be worried about. As a dentist, I reassure patients that silver fillings have been used for more than 200 years and multiple studies have proven that they're safe. These studies come from reputable, controlled experiments and are endorsed by the World Health Organization, the American Dental Association, the British Dental Association and the Centers for Disease Control and Prevention. All dental material scientists are of the view that silver fillings do not pose any significant risk to your health. There is obviously potential risk, but so does anything else that you do in life. Everything does have a risk, so the risk has to be balanced. So the risk that is posed potentially with mercury is that the mercury leaks out into your mouth. You then ingest the mercury. This then gets into your body tissues, potentially, such as your brain, kidneys, liver, and so on, and this can cause harm. It's important to realize that once the mercury is mixed with the other three metals of silver, tin, and copper, the alloy becomes a stable alloy because the mercury is then bound onto the other metals, so it's not free mercury anymore, and it's a free mercury which is considered harmful. This free mercury, also known as methyl mercury, is that which is found in tuna and other fish and other products that can lead to health problems. You will see hundreds and hundreds of articles on the internet which cite how dangerous mercury fillings are and how they cause all sorts of terrible diseases. Unfortunately, most of these, or in fact all of these studies, are not proper scientific tested studies, and often there is no basis for their findings. A person can say that, oh, when they had mercury fillings, that's when their arthritis started to develop. However, the case might be also when they went out to a certain place, or they ate a particular food, or they talked to somebody, or they wore a certain type of clothing, and that's when the arthritis started. So it's really important to take a proper scientific balanced view on this. If there was a better alternative to amalgam fillings, it would be used. However, dental amalgam fillings are currently the best type of fillings, and even most dentists will not hesitate to have them placed in their own mouths or in their children or their family's mouths, because they are a good choice. They are long-lasting, hard-wearing, self-sealing, and technique sensitive.